Liposuction is really better as a contouring procedure as opposed to a weight reduction or fat reduction procedure. So the ideal patient is someone who's close to their desirable body weight, who comes in and says, even when I lose weight, I can't lose my hips, or I can't lose these love handles, or this area in my stomach. Those resistant areas are ideal areas to be considered for liposuction. The four-step technique that I have developed tends to help me get more skin contraction so that I can remove a lot of fat and still get the skin to contour nicely. The technique starts with infiltration of a fluid that helps decrease blood loss and increase the amount of analgesia or numbness for the patients. This is the wand that is used for the external ultrasound, or the probe, and it is applied over the skin like this in a soft, rotating manner. This ultrasound penetrates a small amount and will affect skin contraction in that outer layer that we don't want to perform liposuction in, but it helps with contour irregularities and skin contraction. This is a vibrational energy that actually disrupts the fat cells so that they are removed in a more liquid form, which is more gentle. It provides a large amount of fat removal in an area that might be difficult to remove with the usual traditional cannulas. For example, in men in the love handle areas or women in the hip areas, the fat is more fibrous and often difficult to remove in a traditional manner. After the ultrasound has liquefied the fat, we need to use the traditional cannulas to remove all that fluid. There's some important things that we do post-operatively that help with contouring. Modalities are extremely important in providing the contouring ability that we need after doing liposuction, where we remove large volumes of fat. One of the most popular new procedures in plastic surgery is enhancement of the buttocks. In the past, all we had to work with was implants, and these had a very high complication rate. But today, we have popular procedures for fat grafting the buttocks, and the best time to perform this is when you liposuction the hips. So after the liposuction is performed in the hip areas, then we take the fat that we've taken out and we prepare it and strain it, take off all the fluid, and take the purified fat and re-inject it back in the buttocks. So as you can see from this picture here, you not only get this nice curve in the inner back, but you also get fullness in the buttocks area. It's especially helpful for patients that have that straight waist and flat buttocks. We have patients commonly asking us for the J-Lo buttocks or the Brazilian butt lift, and this procedure, especially more recently, has become very popular because of the emphasis on the rear end that we've had recently.
My name is Marissa Hughes, and I'm a registered nurse. I am the facility director for JKS Surgery Institute, and I had liposuction. During surgery, I was received as a patient as well as a coworker. I was treated very professionally. The results that I've received have been amazing. I've also lost weight in other areas, even though it was just in one specific area that I had the liposuction. Dr. Short treats her patients very kindly. She's very in tune to how they are feeling. She can focus in on what their questions are, really what areas they're apprehensive in. She can definitely focus in on what the patients really are trying to say, and she can pick up on that.